Heart disease describes a range of conditions that affects the heart. Heart diseases include blood vessel disease such as coronary artery disease, irregular heartbeats or the arrhythmias, heart problems or the congenital heart defects. Nursing assessment for patients with heart disease emphasizes evaluating the efficacy of treatment and the patient's adherence to self-management strategies. For the health history, you need to assess the signs and symptoms such as dyspnea, shortness of breath, fatigue, and edema. For the physical examination, you need to assess the dependent parts of the patient's body for perfusion and edema. You need also to assess the liver for hepatojugular reflux. Measure the urinary output carefully to establish a baseline against which to assess the effectiveness of diuretic therapy. Weigh the patient daily in the hospital or at home. Following a thorough assessment, a nursing diagnosis is formulated to specifically address the challenges associated with the heart disease, based on the nurse's clinical judgment and understanding of the patient's unique health conditions. So these are the nursing diagnosis to a patient with a heart disease. So ECG or EKG, also known as electrocardiogram. From the word cardio, it is pointing our heart. So it records the electrical activity of the heart. There are also an echocardiography, stress or exercise test, catheterization of the heart, the cardiac heart or CT scan of the heart. And lastly, the magnetic resonance imaging or the MRI to scan the heart. MRI has proven valuable in diagnosing a broad range of conditions, including cardiovascular anatomical anomalies, functional abnormalities, tumors, and others conditions.
Hi everyone, my name is Arabistal and I will explain to you our nursing care plan for heart diseases, the expected outcomes. First, the expected outcomes of a nursing care plan for a patient with heart disease will vary depending on the specific diagnosis, severity of the condition, and individual needs of the patients. However, I have 5 general expected outcomes. First, improve cardiovascular functions. Second, reduce risk of complication. Third, improve quality of life. 4, increase knowledge and self-management skills. And lastly, improve patient-provider communication. So, I will explain to you these 5 functions in one by one. First, we have improved cardiovascular functions. Maintain cardiac output. The patients will have stable vital signs including heart rate, blood pressure, and oxygen saturation within acceptable range. Also, reduce risk of arrhythmias. The patients will have normal or controlled heart rate with no episodes of significant arrhythmias. It will improve blood flow. Will have no signs of discrete blood flow, such as fatigue, shortness of breath, or leg pain. Second, we have reduced risk of complications. Controlled blood pressure. The patients will have blood pressure maintained within the target range as set by the physicians. Manage cholesterol levels. The patients will have cholesterol levels maintained within recommended limits through diet, medications, or a combination of both. No signs of heart failure. The patients will not experience symptoms of heart failure such as shortness of breath, fatigue, or swelling in the legs. Reduce risk of myocardial infarctions, in short heart attack or cardiac arrest. The patients will implement lifestyle changes and take medication as prescribed to reduce their risk of experiencing a heart attack. Third, improve quality of life. Increase activity tolerance. The patients will be able to participate in activities of daily living and exercise without experiencing significant symptoms. Reduce fatigue. The patients will have improved energy levels and feel less tired throughout the day. Improve sleep. The patients will experience restful sleep without interruptions. Reduce anxiety and depressions. The patients will have improved mental health and well-being. 4. Increased knowledge and self-management. So, if the patients will understand their heart disease and the importance of managing their conditions, will be able to identify and manage their symptoms. And also will be able to take their medication as prescribed. Important, the patients will be able to make healthy lifestyle choices such as eating a healthy diet, exercising regularly, and managing stress. So lastly, we have improved patients provider communications. First, the patients will feel comfortable discussing their concern and question with their healthcare provider, will be actively involved in making decisions about their care. Lastly, will have access to support groups and other sources. So, it is important to note that these are just general expected outcomes, and the specific outcomes for an individual patient will vary depending on their unique situations. The nursing care plan should be individualized to meet the specific needs of each patient. And that's all. Thank you.
So these are the nursing interventions. Set the goal with the patient. Administer medications as ordered. Instruct on a lifestyle modifications. Consider device therapy. Anticipate the possibility of surgery.
Rationale. Strategies to enhance cardiovascular performance. Taking prescription drugs as directed. Observing the vital signs. Giving oxygen treatment. Enhancing exercise participation. Teaching the patient about their illness and prescribed drugs. Strategies to lower the risk of complications. Regulating the blood pressure. Controlling cholesterol levels, and keeping an eye on blood sugar levels.
For the expected patient outcomes, the following are evaluated: demonstration of tolerance for increased activity, maintenance of fluid balance, less anxiety, decide soundly regarding care and treatment, adherence to self-care regimen. Evaluation is a crucial aspect of managing heart disease, identifying the presence and type of the condition, assessing its severity, providing treatment guidance, satisfying risk factors, monitoring progress, preventing complications, educating patients about the treatment options, and contributing to medical research. It helps healthcare professionals tailor treatment plans to individual patient needs, monitor progress, and prevent complications. Regular evaluation also helps in educating patients about their condition and the importance of adherence to prescribed therapies. This continuous evaluation enhances patient care, facilitates informed decision making, and ultimately improves outcomes.
The Heart Foundation recommends plenty of vegetables, fruits, and whole grains, a variety of healthy protein sources, especially fish and seafood, legumes such as beans and lentils, nuts and seeds. Smaller amounts of eggs and lean poultry can also be included in a heart-healthy diet.